Good afternoon, members of the Fourth Estate. Welcome to our 42nd brief on coronavirus response in the country. Fellow Kenyans, welcome to our daily coronavirus update. Yesterday, we issued specific guidelines on how eateries and restaurants will be reopened. Today, we want to confirm to you that the protocols and management guidelines have since been uploaded on our website, and these can be accessed on www.health.go.ke. We encourage those interested in reopening their facilities to dedicate some time and keenly go through the protocols in order to be familiar with all the requirements before opening. On a related matter, since we first reported our first COVID-19 case, we have recorded many recoveries of our people who have successfully been treated for the disease and who have been able to go home. While we celebrate these recoveries, we are disturbed that reintegration has not been easy for these people. We have reports of stigmatization by members of the community for our recovered cases. And this is unfortunate, considering our constant appeal and massive education to ensure that people are accepted back in the community. Just this morning, fellow Kenyans, we had a briefing with one of our recovered cases from ICU, a gentleman who was able to recover from coronavirus disease. And as he was sharing his story with us, he's given us disturbing events with regard to how he's been accepted back in the community, issues and experiences that have not been pleasant for him and his family. And we need to appeal to you and to remind us all that the only way we can be able to beat this disease is if we avoid issues like stigmatization. Stigmatization will lead to fewer Kenyans accepting to be tested, and it will frustrate the efforts that we are putting on the ground to ensure that we flatten this curve. So we really do appeal for compassion in the community, for understanding, and even for celebrating these people who have been able to go through such a scourge and come out and recover. We do continue to appeal to our brothers and sisters to be considerate, to warmly welcome and embrace our people when discharged from hospital. And to this end, we are taking additional and deliberate steps to partner with patients who have recovered to spread their awareness. We are glad that the number of recoveries keeps rising day by day. And today, we've discharged an additional 5 patients, and this brings to the number of total recoveries 129. Regarding our COVID-19 situation, we continue to see a trend where we have new positive cases recorded primarily in Nairobi and Mombasa counties. While this may be indicative of the disease being domiciled in these 2 counties, it is also a pointer to the immense work that is required in Nairobi and Mombasa. And therefore, as we spotlight Nairobi and Mombasa and ensure that we enhance our interventions there, this is not a license for other counties to celebrate and to drop their guard. Rather, it is a call to action for the rest of the country to enhance the containment measures and to ensure that the virus is kept at bay and the curve is flattened. In the last 24 hours, we have tested a total of 508 samples from 14 counties. Out of this number, 10 tested positive for coronavirus, and of these, 9 are from Mombasa and 1 from Nairobi. This brings to total 384 total number of positive cases in the country. From the number tested, 284 samples were from Nairobi, while 89 were from Mombasa. All the 9 cases in Mombasa were picked from the community by our disease surveillance teams. And it is important that I emphasize at this point that indeed, from the data that we are synthesizing, we are noting that in the beginning of this scourge, we had most of the cases being imported cases, but right now, the tables have turned and most of our cases are coming from local transmission within our communities. And so our containment measures are quite crucial at this point. Each of the following areas has had 1 case: Old Town, Santana, Miritini, Bamburi, Mikandani, Kibokoni, Ganjoni, Memon, and Chuda. The Nairobi case is from Kawangware. As government, we have continued to partner with Mombasa County on containment measures to curtail the spread of infection, and we are organizing for additional and enhanced surveillance and management support for Mombasa County. We are also urging Mombasa County residents to rededicate themselves in this fight and support the county government of Mombasa and national government in helping to contain this virus. With regard to age distribution, today's 10 cases are aged between 12 and 63 years, and in terms of gender, 6 are male and 4 are female. We have also shared with you the current distribution of cases by county of detection and isolation, and this will be availed to you. It's important to note and maintain that Nairobi and Mombasa maintain lead with the highest number of isolated cases. We do thank you all Kenyans for your continued commitment in this fight, but we also would like to remind you to remember to be compassionate and to be your brother's keeper. Together, we will be able to beat this virus. And again, fellow Kenyans, the matter of stigma could actually take us behind if we don't work together and remember that we are our brother's keeper. At this juncture, I'd like to invite Waziri Wamalwa to give updates on county preparedness. Karibu, Waziri.
Thank you very much, ladies and gentlemen. And I'm here today on behalf of the Ministry of Devolution and Asals and the State Department of Special Programs to appreciate the good work that our colleagues at the Ministry of Health are doing on behalf of national government, and particularly with regard to collaborating and cooperating with the counties. We've been working very, very closely, both levels of government, to deal with these situations, and indeed they have done a wonderful job. Today, I've come to engage them further to see how we can strengthen this collaboration, how we can also increase support to the counties, particularly those that are most affected. I'm very happy that from our meeting today, a lot is being done towards this direction of increasing support. And I was happy to learn today that more support is being given to Mombasa. As you have heard from the cases reported, Mombasa is a hotspot. And indeed, from the cases reported today, the highest cases have come from there. But a lot of support is being lent to Mombasa in terms of PPEs that already have been dispatched, and I'm very happy to note that support. We also want to say that though we have the COVID situation in the country, and we are dealing with it, it's not a local issue, it's a global issue. We also are in the same breath dealing with another disaster of floods. In the midst of COVID crisis, the floods are back with us. As you remember last year, we started with drought at the earlier part of the year. Then we had floods beginning September going into October. Towards the end of the year, we had locusts. Indeed, our nation is a resilient nation, but our resilience has been tested over the last 1 year. So today, as we speak, we have several counties that have been affected by floods due to the heavy rains that are ongoing. They have suffered landslides. You heard about West Pokot, Elgeyo Marakwet, Kipkelion, and other areas that have suffered landslides. As a ministry in charge of special programs, we have put measures in place to ensure we give support to all families affected. As of today, we have been able to dispatch over 40,000 bags of rice and other food and non-food items to over 24 counties affected by floods. What we are urging that the families affected need our support. And even as we give them humanitarian support, we want to urge the counties to comply with the guidelines given by the Ministry of Health in terms of social distancing. It might be a challenge where we have families displaced, gathered in schools, but we must still utilize the schools that are yet to be opened to create enough space and distancing to ensure that we do not, in the process of supporting or lending humanitarian support to families displaced by floods, also expose them to the coronavirus. We want to ensure that also, as we distribute food, we are able to heed the guidelines given by the Ministry of Health. The protocols on food distribution have already been shared with the counties. And mine today is to urge the counties to heed those protocols. Even as we bring food to them, we want this food distributed through the county emergency teams, co-chaired by the governors and the county commissioners. We urge all leaders, including other politicians, to please work with the emergency response teams to follow the protocols even when distributing this food. As of today, the counties that I've said are affected are up to 29. And those that have lost lives, as we speak today, we have had over 116 lives lost to floods. We have also had over 100,000 households displaced. So we are urging that this humanitarian crisis that we are facing, even as we face it, let us work with the Ministry of Health and all the guidelines that have been given. So we want to thank you very much, Daktari, and urge that I think the country is happy with the updates, with the briefs that we have been receiving, but the counties are also urging that would like to see you and CS Kagwe coming down to the counties to actually get to the ground and see the state of preparedness in each county. And on behalf of the counties, we'll be very, very happy to accompany you so that we get down to the ground, see the situation as it is in different counties and the state of preparedness, so that we see how to deepen and to widen the support and cooperation and collaboration between the two levels of government so that we can cushion Kenyans against this COVID-19 and the pandemic, as well as the floods and the locusts and all that are facing us today as a country. So let me thank you once more and urge you to come to the counties. Asante.
Yes. Tumesikia huo mwito na tutakuja. Thank you.
Yes.
Now over to questions.
One case that is at Kawangware. Yesterday you did actually get 1 or 4 cases. I don't know what mechanism are you maybe planning to effect, particularly in those areas, because I understand the Kawangware market is still operating normally. There are so many people at the market center. Maybe as a government, are you maybe planning to close up the market?
My name is from KBC. CAS, Dr. Mercy, I would like to find out on the challenges that the government is facing, because we've been talking about rolling out mass testing, and that has not, you're still doing the target testing thus far, and from what you can see from other nations, mass testing is really helping in knowing how many people are sick, and then they could consider reopening the economy or slowly easing those lockdown restrictions. And then the other point, the other question goes to the CS for devolution. Sir, probably as the CS, apart from the people who've been affected by floods, status of preparedness in counties on COVID-19, would you say that probably Kenyans do not require any kind of aid, because most people have been asking for support, especially on food and other basic needs?
The last one.
Yeah.
Jimmy Mbogo from K24. Now, my question is, out of the 129 cases that have recovered, do we have patients that already had existing conditions, and how many are they? Number two, CS Omalo has talked about Mombasa getting additional support. Maybe what kind of support are we looking at?
Great. Thank you. So I'll start with the first question from NTV with regard to the case in Kawangware. Indeed, the idea is that, yes, Kawangware now is an area that's under surveillance for us, especially after this first case, but also an area that is under surveillance for us because we have actually been monitoring with regards to adherence of the containment measures. And we've identified markets as one of the possible areas of transmission. If we look at the response that has been put in place by our different supermarkets, you can see that there's strict adherence to masking, there's strict adherence to use of sanitizers where necessary, and there's also adherence in terms of social distancing. I myself was actually touring the market this weekend, and I was able to see that in the marketplaces, some of these measures are not being adhered to. And so going forward, what we're doing is that we're going to deploy more surveillance teams. You'll be seeing all the different markets which have been marked as possible hotspots, having increased surveillance, having increased measures in terms of fumigation. We have a team that has come together with a schedule of how that will look like, but also coming up with innovative ways of how Mama Mboga can still continue with her trade, but ensure that social distance is facilitated. And I think this is an issue that we'll be able to elaborate on further. We do now have the call to be on the ground and to do those spot checks, and you'll be seeing most of us there trying to interact with the public and even have lessons as to how you can correctly put on a mask. Like I said, during the weekend over at Kawangware itself, I could notice people had masks, but they were on their chins. So these are some of the measures that we're going to be putting in place. With regard to Purity's question on challenges that we are facing, indeed, we've told you in past press briefings, there are challenges in trying to run a successful turn of a test. The tests that we are currently conducting are known as molecular tests, PCR tests. And for you to be able to do a PCR, after taking the sample, you have to run it through certain steps and mechanisms to be able to get your end result. Because of the global shortage, every time we get the kits, for example, you've seen we've gotten kits from JACMA, and even the Ministry of Health has procured kits. Every time we get the kits have certain components that come together to be able to do a successful run. And the greatest challenge that we are facing right now has been with the supply of nasopharyngeal swabs. We have had a series of interventions and meetings with different players to see how can we domesticate that swab to be able to ensure that it's actually utilized properly to correct the sample and to run a successful test. It's important to note, in terms of capacities, the country does have capacity to run tests. In fact, almost 37,000 tests a day, we can run them. However, it would require ensuring that we have all those inputs and components that go into a successful run for a test. Testing be as it may, we have sat down and asked ourselves, if we do not have enough supplies, what shall we do in terms of measures in ensuring that containment is upheld, but also ensuring that there's a surveillance mechanism. And so what we will be deploying shortly is what we are calling seroprevalence studies within the environment. So taking an area like Kawangware and asking ourselves, the population in Kawangware, have they come into contact with any coronavirus case? And if they have, are there antibodies showing that? And so there's going to be a serosurveillance prevalence study being undertaken. Thirdly, we've read and say Purity has a temperature, she has these symptoms, perhaps we need to focus on Purity and test Purity. So there are mechanisms we are putting in place to ensure that at the end of the day, with the challenges that we have, we still have a surveillance system that is robust. With regard to our 129 cases and their conditions, that's a very good question. We have a team of epidemiologists who are here with me today. We have Dr. Kuria here, who is heading the public health department. We are looking at our patients and segregating them in terms of their morbidity. So are you a person who has suffered COVID-19? Do you have diabetes? Do you have hypertension? Are you asthmatic? Do you have perhaps issues, that would be able to predispose you to the disease or affect your management? We have this data for you, and we will share it with you tomorrow. We'll also be able to give you a disaggregation of our severe cases, those who had comorbid states and those who did not. So this will be coming up tomorrow. We have that data. I'd like the Director of Public Health, Dr. Kuria, to elaborate further on the fumigation and the strategies we are putting in place in the markets. Karibu, Daktari. Fumigation.
Thank you, Madam CS, member of the Further State. I would probably respond to this in relation to the case that is from Kawangware and any others that we may have picked up having turned positive from any of our estates in Nairobi and indeed in the country. What normally happens is that when a case turns positive, we send out our ambulances through the rapid response teams to pick up those positive cases. Another group then follows that team that does contact tracing around that case. Some of them who may have symptoms then are isolated immediately, and others who do not. Sometimes we take samples for testing and advise them on the further quarantine measures. But on that particular area where I've picked up the case, we normally have another team that follows, that does fumigation of that area. And we follow up the following day with further contact tracing and further fumigation within 1 week. You may be aware that yesterday we handed over the management of health service in the Metropolitan to the Nairobi Metropolitan Service. And one of the issues that arose that we need to partner with them is what we have been doing in the quarantine centers and even where we have picked up patients, that we want to partner with them and make sure that program runs the fumigation, and furthermore expand that even to those areas that are called the informal settlements, that we increase our fumigation measures in partnership with the Nairobi Metropolitan Service. So yes, we do fumigation, and we continue doing that in partnership with the Nairobi Metropolitan Service.
Thank you all.
Thank you very much. As to the state of preparedness of the counties, I want to thank the governors across the country who have done quite a lot to prepare for this. And as we speak, all our 47 counties have each set up an emergency unit. As you are aware, His Excellency the President directed that 5 billion be released to the counties. This is going to help the counties build capacity. And I was just speaking to the chair, Governor Oparanya. They're in the process of ensuring that they are better prepared with what they have received from national government. And we also are releasing masks through our provincial teams. As of today in our meeting, we're discussing how, as we distribute relief food to families displaced, how we can also be distributing masks and sanitizers. And I'm very grateful to the Ministry of Health for the plans they have put in place through our county emergency teams to be in a position to ensure that even as we distribute food, we don't devolve corona to those camps and to the counties. So I want to assure Kenyans that a lot is being done to give that support to the counties. And from the Ministry of Devolution, we also have the Kenya Devolution Support Program. Over 4 billion will soon be released to the counties. And we are urging the counties to prioritize the COVID emergency responses in utilizing these funds to build capacity, to have more bed capacity. There are some that just need a few millions to be able to complete that. So this is the support we are giving them, and we want to assure them of continued support. But for the displaced, we want to assure Kenyans that we have enough food in the country, and we will be able to support all those who have been displaced so that they are able to receive this support. But even as we support them, we want to be cautious so that we heed the Ministry of Health guidelines. Thank you very much.
Nyaji wa Kenya, hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water, apply a small amount of soap, rub palms together, rub fingers and thumbs and the bits in between, rub nails on palms, rub the back of each hand, rinse with clean running water, and dry thoroughly with a clean dry towel.
Furthermore,
It is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of a respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
You may be alone at home, but you can show solidarity with others by sharing Bonga Points. Share your Bonga Points with your family and friends who are in need but can't afford to buy food. Share your story or video of how you've helped a fellow Kenyan to our FB page NTV Kenya, Twitter page at NTV Kenya, Instagram at NTV Kenya, SMS 20686 or WhatsApp number 0745 925 002.
Japo njia bora zaidi ya kuhakikisha usafi wa mikono ni kutumia maji na sabuni, katika baadhi ya sehemu wameweka mchanganyiko huu maalum wa kutoa uchafu maarufu sanitizer, na tunahimizwa kila tunapotumia tuhakikishe kwamba sehemu zote za mkono zimeupata mchanganyiko huo kwa kufanya hivi kwa takriban sekunde 20 hivi, na tuhimizane wenyewe kwa wenyewe kufanya usafi, manake wapo mwenzako hatafanya usafi basi anakutia wewe hatarini.
Kenya's economy is in uncharted waters. A healthcare emergency has become an unprecedented economic crisis, characterized by job losses, pay cuts, company closures, the near collapse of the SME and informal sectors, disrupted supply chains, and deserted markets as consumers stay away in fear of possible infection. Revenues are depressed, and overall, the economy is taking a massive hit. Various measures, including a raft of tax cuts, increased cash transfers, and loan repayment holidays, have been introduced with the aim of mitigating some of these challenges. What do these measures mean to Kenyans? And what more can or needs to be done to further alleviate their suffering? On Thursday, 30th April 2020, the Nation Media Group will hold a live virtual Nation Leadership Forum starting 7:30 p.m. on NTV. We will be unpacking the economic challenges COVID-19 presents, the various measures introduced to deal with these challenges, and what needs to be done to lead Kenya on to economic recovery. Nation Leadership Forum, engaging society, impacting the nation.
Mind-blowing music and entertainment. Just move to NTV.
government offices, businesses are encouraged to allow employees to work from home.
Working from home is actually a feature companies need to look into.
When we load important services onto technology platforms, if we are not very careful, you will end up excavating the inequalities.
There's a great opportunity for Kenya to localize a lot of the goods.
Necessity is the mother of invention. You've come up with this invention at the right time.
Tumesimamishwa kazi. The business definitely it's a huge shift.
It will call for sacrifice, including pay cuts.
We do not want Kenyans to lose jobs unnecessarily. We have to find some money to be able to manage payrolls.
The state is the guarantor of business in any country.
Akili, 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 akili. Let's chase the germs away. Let's chase the germs away by keeping our hands clean. And when you want to sneeze or when you want to cough, do it in your elbow. Let's practice sneezing into your elbow. Are you ready? 1, 2, 3. Achoo! Again. Achoo! You did it! Germs, 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 they make us sick. Germs, germs, germs are not our friends. Germs, 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 they make us sick. Germs, 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 germs are not your friends.
What are your plans now? Erica's been reunited with her son.
Honestly, Agatha, I really don't know if I should praise or hate your sister.
You should hate her.
That mother and son might report us to the authorities. Now we've got a new problem. We have to get rid of Jolo and Erica as soon as possible.
If that doesn't happen, you and I will take him down ourselves.
What happened to our men?
Unfortunately, they were killed by the cops.
I'm sure they'll do everything to silence my son. And until those kidnappers are caught, none of us are safe here.
Heaviness and a burning inside, it could be heartburn.
Indigestion and heartburn? Eno gets to work in 6 seconds and works on the 6 symptoms of heartburn so you can keep living life non-stop. Eno, fight heartburn and indigestion fast.
And them say here comes trouble, here comes the danger, sent by the Savior, welcome the Rasta youths. I and I start recruit soldiers for Selassie army. Here comes trouble, here comes the danger, welcome the Savior, welcome the Rasta youths. Then up the access, and then the revolution in the world. When you all look down on that different, I hear it.
You spoke, we listened, and now every weekday at 6:30 a.m. you can join Evelyn and Peter to get your daily fitness fix. Some body exercises and some dancing, while at each you could even lose some weight. Get moving, we guarantee you will love it.
Have you shared your bongo points with someone who needs them? Remember to help a friend or anyone in need to buy food using your bongo points. Stay at home, but still stay together with your loved ones and friends using bongo points. Share your story or video of how you've helped a fellow Kenyan to our FB page NTV Kenya, Twitter page at NTV Kenya, Instagram at NTV Kenya, SMS 20686 or our WhatsApp number 0745 925 002.
Je, maumivu ya kichwa na kukosesha amani? Kaluma Strong hutuliza maumivu ya kichwa, maumivu ya mwili na hata huondoa joto jingi mwilini. Kaluma Strong ina aspirin kama kiungo. Maumivu yakizidi, muone daktari.
This is NTV.
Natumai hujambo popote ulipo. Saa 10 kamili saa za Afrika Mashariki. Ramadhan Mubarak kwa ndugu zangu Waislamu. Mimi ni Kaltun Jama. Mombasa inazidi kuongoza katika maambukizi mapya ya corona nchini. Kati ya maambukizi 10 mapya, 9 ni kutoka kaunti ya Mombasa. Idadi jumla ya maambukizi nchini sasa imefikia watu 384.
In the last 24 hours, we have tested a total of 508 samples from 14 counties. Out of this number, 10 tested positive for coronavirus, and of these, 9 are from Mombasa and 1 from Nairobi. This brings to total 384 total number of positive cases in the country. From the number tested, 284 samples were from Nairobi, while 89 were from Mombasa. All the 9 cases in Mombasa were picked from the community by our disease surveillance teams. Each of the following areas has had 1 case: Old Town, Santana, Miritini, Bamburi, Mikandani, Kibokoni, Ganjoni, Memon, and Chuda. The Nairobi case is from Kawangware.
Idadi ya visa vya Covid-19 nchini jirani Tanzania imepanda hadi 480 baada ya visa vipya 196 kuripotiwa hii leo. Waziri Mkuu wa Tanzania Kassim Majaliwa vile ametangaza kwamba idadi ya vifo pia imepanda hadi 16 baada ya watu 6 zaidi kufariki kutokana na Covid-19. Kwa mujibu wa Waziri Mkuu, visa vipya 174 vimerekodiwa Tanzania bara, ilhali watu 22 ni kutoka kisiwa cha Zanzibar. Aidha, idadi ya waliopona kutokana na corona vile imefika watu 167 kutoka watu 48.
Na kuanzia tarehe 23 mpaka tarehe 28 mwezi huu, toka mwanzo mpaka sasa, kwa ni 480. Kati ya wenye maambukizi 297 waliobaki, watu 283 tunafurahi kueleza taifa kwamba wanaendelea vizuri na tiba na kusubiri na kufuatiliwa afya zao, na tunao wenzetu 14 ambao wako kwenye uangalizi wa karibu na madaktari wetu. Hawa ni wale wanahitaji oxygen ili kuwasaidia kupumua.
Kampuni ya Safaricom hivi leo imesema kuwa ilipoteza shilingi milioni 650 kutokana na kutotoza malipo wanaotumia pesa zisizozidi shilingi 1000 kupitia M-Pesa katika mwezi wa Machi. Safaricom ilisema hayo ilipokuwa ikitangaza matokeo yake ya mwaka mzima wakati ya Machi 2019 na Machi mwaka 2020. Katika kipindi hiki mapato halisi ya Safaricom yaliongezeka kwa asilimia 19.5 kufikia shilingi milioni 73.7. Ingawa mapato yanayotokana na huduma ya simu za sauti na arafa fupi yanaendelea kupungua, huduma za M-Pesa na data zinaendelea kuimarika kwa kiwango kikubwa, kuipa kampuni hiyo faida kubwa. Huku mazingira ya kibiashara yakiathiriwa na makali ya janga la corona, kampuni ya Nation Media Group sasa imechukua hatua za kupunguza mzigo wa mishahara kama njia mojawapo za kukabiliana na changamoto hizi. Kulingana na taarifa kutoka kwa afisa mkuu mtendaji Stephen Gitagama, wafanyikazi walio na mshahara unaozidi shilingi 50,000 kila mwezi watakatwa malipo kwa kati ya 5% na 35% kuanzia mwezi Mei kwa muda wa miezi 3 ijayo. Kampuni ya Nation ilipata faida ya shilingi milioni 862 mwaka jana, ishara tosha kwamba japokuwa kuna changamoto katika mazingira ya kibiashara, kampuni hii ingali na misingi thabiti kibiashara. Kinara wa chama cha ANC Musalia Mudavadi ameitaka serikali kutoa mwelekeo kuhusu mitihani ya kitaifa KCPE na KCSE ili kuandaa kisaikolojia watahiniwa. Mudavadi amesema kauli za mara kwa mara za kwamba hakuna uamuzi uliochukuliwa kwa kuahirisha mtihani hiyo hazitoshi.
Without clearly defined and equitable state-owned and state-facilitated learning packages, it is misleading and even mischievous to claim that learning is going on. It is not. Not every learner has access to radio or TV, and less still to the internet. Even those who can physically access these facilities are challenged with the costs of activating them. Let us not cheat ourselves. Let us accept that things are bad.
Utata umeibuka katika eneo la Donholm, kaunti ya Nairobi kuhusu kipande cha ardhi cha ekari 2.9 baada ya mmiliki wa kampuni ya Oyster Moses Mureithi kudai kuwa watu wasiojulikana wamenyakua ardhi hiyo. Akizungumza na wanahabari katika ploti iliyo na mkabala na iliyozozaniwa, Mureithi alitoa stakabadhi za kuonyesha umiliki wa shamba hilo ambalo alisitiza alipata kwa kufuatia taratibu zifazo ili kupata hati miliki. Anadai kuwa kuna wahuni wanaotaka kumnyang'anya kipande hicho cha ardhi. Aidha, Mureithi alidai baadhi ya umiliki wa kampuni ya Savannah wanapinga umiliki wake licha kuwa ana stakabadhi za mahakama kuhusu ardhi hiyo. Shamba hilo limezozaniwa kwa zaidi ya miaka 5 na wakati wa uamuzi wake wa mahakama ilitambua kampuni ya Oyster.
Even 1 minute more than necessary na uko na watoto na bibi kwa nyumba. If they don't leave, the law will take its course. We guys have filed these documents with OCPD Buruburu, and now we are going to formally take the same to him in this file, but he already has copies of the same yesterday. So we've filed, we've given notice that we intend, we've finally got a contractor who's ready to move on site, who was ready to move on site yesterday, and he's been waiting. So it's time for us to build our wall during COVID and give young people in this area some work, because guys are starving.
Mtazamaji, sasa tuangazie mengine ambapo zaidi ya familia 20 zimeachwa bila makao katika eneo la Kuresoi Kaskazini, kaunti ya Nakuru kufuatia mvua kubwa inayoendelea kunyesha katika eneo hilo. Baadhi ya familia hizo sasa zimepata makao ya muda katika shule moja ya msingi katika eneo hilo. Ndiyo taswira kamili katika kijiji hiki katika eneo bunge la Kuresoi Kaskazini kutokana na mafuriko yanayotokana na mvua kubwa inayoendelea kunyesha katika sehemu nyingi nchini. Kina mama na watoto hususan wameathirika zaidi miongoni mwa familia hizi, na ni dhahiri kwenye nyuso zao kuwa hali ni ngumu hapa.
Iwapo wataenda kukaa sehemu hiyo katika ile hali tuliona, magonjwa ikisuka itasababisha uharibifu mkubwa. Tutakuwa na magonjwa kama malaria, typhoid, bilharzia, dysentery na pneumonia.
Wakazi hapa wanahofia mchamko wa maradhi kama vile kipindupindu ndio tishio baada ya vyoo vya kijiji hiki kuanza kuvuja na kumiminia takataka kwenye makazi. Ikizingatiwa kuwa usafi ni nguzo muhimu ya kukabiliana na janga la Covid-19.
Hata watu wengine hapa wajakula karibu siku 3. Hivyo hata blanketi hapa ni shida. Hata kuna mahindi yenye imekuwa kwa nyumba hapa yenye ilikuwa imekongolewa imeloa maji.
Ni hali ambayo imewapata ghafla wenyeji, kwani mafuriko hayakutarajiwa kutokea hapa. Hakuna aliyepoteza maisha, lakini maisha ya wakazi yamebadilika pakubwa. Kaltun Jama, NTV. Viongozi kutoka kaunti ya Pokot Magharibi wamemshtumu kamishna wa mkoa wa Bonde la Ufa George Natembeya kwa kusitisha shughuli ya kutafuta watu 17 ambao hadi sasa hawajulikani waliko kufuatia mafuriko yaliyosababisha maporomoko ya ardhi na vifo vya zaidi ya watu 20 eneo la Chesogon. Lakini Natembeya anasema viongozi hawa wazingatii uhalisia wa mambo. Judith Echerono na maelezo zaidi.
Kamishna wa mkoa wa Bonde la Ufa alisitisha shughuli za kuopoa walioangamia Chesogon baada ya juhudi za kutafuta miili zaidi kukosa kuzaa matunda kutokana na wingi wa mawe na udongo kwenye maporomoko baada ya janga hilo. Wakati wa kufunga shughuli hiyo, Natembeya aliongoza hafla ya kuweka mashada ya maua kwenye kingo za mto Chesogon kuashiria kukamilika kwa mpango huo. Viongozi wa eneo hilo wanakosoa hatua hiyo.
Naona hiyo haikuwa sawa kwa sababu watu bado wana imani kwamba watatafuta na labda wapate mili ya wapendo wao ili waweze hata kupata nafasi ya kuasika.
Viongozi hao sasa wanahimiza serikali ya kitaifa kubatilisha uamuzi huo na kuwaruhusu wakazi waendelee na upoaji, kwani takriban watu 20 wangali kupatikana. Lakini kwa mujibu wa Natembeya, viongozi wanamkashifu hawajazingatia uhalisia wa mambo eneo hilo la tukio.
Bwana Natembeya pamoja na timu yake, ajabu ni kwamba bado watu 3 kutoka West Pokot hawajapatikana mpaka sasa. Watu 20 na kitu upande wa Marakwet mpaka sasa hizi hawajapatikana. Lakini anakuja juzi na kuita tu wale watu yake ambao alikuja nao kwa ndege moja na kuweka kitambaa hapo chini na kuomba na kusema kwamba sasa ya kutafuta mili ya watu ama kutafuta hao watu imefungwa. Ni nani atatafuta wale 20 na kitu? Nani atatafuta hiyo watu? Aliuliza nani?
Akiongea hii leo baada ya kutembelea wanaouguzwa hospitalini MTRH kufuatia mkasa huo, Natembeya alisema viongozi hao hawazingatii ukweli wa mambo.
And we also want our leaders also to respect some of these things that we do, because even as we are carrying out work in that particular area, some are holding rallies in another part of the affected area, and so some of the victims prefer to attend political rallies than join us in the search. So when they eventually came to start searching, they were searching in areas that we had already searched and there was nothing. So it just became a futile exercise.
Wakati huo huo, watu karibu 60 wanakadiria hasara ya dhamana isiyojulikana kufuatia mkasa huo ulioathiri watu zaidi ya 150. Judith Cherono, NTV.
Wauguzi na wagonjwa katika hospitali kuu ya Bungoma wanalalamikia hali duni, hususan msongamano wa wagonjwa katika hospitali hiyo ya umma wakati huu ambapo taifa linapigana na janga la Covid-19. Ruth Munyi na maelezo zaidi.
Hii ndio taswira katika hospitali kuu ya Bungoma, kaunti ya Bungoma. Wagonjwa wengi wamelazimika kugawana nafasi katika vitanda vichache vilivyopo. Hospitali hii ina vitanda 240, ilhali nyakati nyingine wanalaza zaidi ya wagonjwa 400 kwa wakati. Wahudumu wa afya katika hospitali hii wanasema wanafanya kazi kwa saa nyingi kila siku bila kupumzika. Je, ni mikakati ipi hospitali hii imeweka kuhakikisha wagonjwa hawataambukizwa ugonjwa wa Covid-19?
Hospitali yetu tunafanya uchunguzi na tunajaribu kuscreen. Tuangalie kama wewe uko na dalili za ugonjwa wote ambayo wa respiratory tract, then tunasema kwamba hatutakuadmit katika wodi yetu. Tunakupeleka kwa isolation ama tunakutenga na hao wagonjwa wengine ili wasipate kupata maradhi ya respiratory tract.
Kwa sasa ombi lao kuu ni kwa serikali ya kaunti kuingilia kati kuondoa kadhia inayowakabili. Ruth Munyi, NTV.
Wakazi wa Busia wanaishi karibu na eneo la mpaka wa Kenya na Uganda wamelalamikia kile wanachodai ushirikiano wa polisi na baadhi ya madereva wa malori ya mizigo wanaendesha biashara haramu ya kuingiza makaa nchini kupitia njia za mkato. Wakazi wanasema hali hiyo inahatarisha maisha yao, kwani madereva wanaoingia nchini kutoka Uganda hawapimwi corona kama inavyotakiwa. Kamishna wa kaunti ya Busia Joseph Kanyiri amedhibitisha kupokea rasmi la malalamisho ya wakazi na kusisitiza kuwa afisa wa polisi atakayepatikana na hatia atachukuliwa hatua kali za kisheria.
Hawa dereva wanatoka mbali, wengine wanatoka Kongo, wengine wanatoka Uganda, wengine wanatoka Nairobi, wengine Mombasa, zile sehemu ambazo zimekumbwa sana na hii ugonjwa ya corona. So mimi kitu ambayo naweza sema, hii corona ikianguka hapa Busia, watu ambao wataangamia sana ni wamama na sisi vijana na watoto wetu.
Ningehimiza maskari wetu, tafadhali mahakikisha kwamba trailer zetu zote zinapita custom. Huyu mtu aende apimwe. Msikubali vitu ya hongo hapa. Msichukue pesa kwa hawa watu. The moment mnachukua pesa, mtakuwa mna-entertain trailer zote ambazo zinatoka nje, hazitaenda custom. Zitapita hapa mkato, zichukue makaa hapa na zirudi wapi? Nairobi. Kwa hivyo let us not risk the life of Kenyans.
Tunajadiliana na wenzetu pande ile, hatungependa kuonyeshana vidore kwa haya mambo, lakini ni kushukuria mtu hatua. Tunafahamu kwamba kumefanyiwa change over ya baadhi ya wale wamekuwa wakishughulika na usalama kwa sehemu za mpaka wetu, Adungosi, Sofia na kwingine ambako kuna hizo watu huita panya routes.
Kituo cha watoto cha Bethel Children's Home mjini Londiani kimepata afueni kubwa baada ya jamii ya Wahindu kutoka Kericho kutoa msaada wa chakula na vitu vingine muhimu vitakavyowasitiri kwa muda wa mwezi mmoja. Mkurugenzi wa Bethel Paul Matingwon amesema kwamba msaada huo utawasaidia mayatima 63 wanaoishi nyumbani humo wakati huu mgumu wa janga la corona. Payank Patel, mmoja wa hisani wa jamii ya Kihindu, alisema wanachama hao wako tayari kuwasaidia watu ambao hawajiwezi katika jamii kwa kuwapa chakula na mahitaji mengine. Afisa wa serikali ya kaunti ya Kericho Timothy Kemei alipokea msaada huo Kipkelion.
Is an alumnus of this place, having stayed here for around 18 years or so of my life, and as my brothers and sisters here, on behalf of this entire community here, I want to say thank you so much, and I pray that God blesses you and even expands your businesses so that you may continue with your big hearts to reach out to other people as well.
And it's nice to see that these children are happy, and I would like to thank the management for the good work they are doing in raising these children by giving them hope, by providing a roof and offering education.
Mtazamaji, dakika zimekatika 16 baada ya saa 10 kamili saa za Afrika Mashariki, na sasa tuangazia habari za spoti ambapo idara upelelezi DCI nchini imeshika usukani katika uchunguzi wa madai ya mwanahabari wa Norway kwamba mwanariadha wa Kenya eneo la Iten wamekuwa wakitumia dawa marufuku michezoni. Mwanahabari huyo alituma picha za sindano za kudunga dawa alizodai zilitupwa na wanariadha katika uwanja wa Kamarin huko Iten. Wanariadha kufanya mazoezi katika uwanja huo mara kwa mara walikuwa wametumia muda mfupi kabla ya janga la Covid-19 kuathiri shughuli. Shirikisho la riadha nchini AK limepuzilia mbali madai hayo, huku likisema kwamba vyombo vya habari vya kimataifa vimekuwa vikifanya taarifa za aina hiyo kuharibia sifa Kenya kila tunapokaribia mashindano ya kimataifa. Kenya imekumbwa na masaibu ya wanariadha kuhusishwa na matumizi ya dawa ya kusisimua misuli, huku aliyekuwa bingwa wa London Marathon mwaka 2017 Daniel Wanjiru, aliyekuwa mshirikizi wa rekodi ya dunia marathon Wilson Kipsang, na aliyekuwa bingwa wa dunia kwa chipukizi katika mita 800 Alfred Kipketer wakipigwa marufuku tangu mwanzo wa mwaka huu. Shirikisho la kandanda barani Uropa UEFA limezipa ligi zote za bara hii leo hadi Mei 25 kuamua iwapo zitairisha zaidi au kufutilia mbali kabisa. Kandanda imesitishwa katika mataifa yote ya bara Ulaya isipokuwa Belarus kwa sababu ya janga la corona. Ligi kuu ya Premier Uingereza imeanza kampeni maalum wiki hii itwayo mradi wa kwanza nafsi. Wakuu wa ligi ya Premier wanatazamia kwa matumaini ya uwezekano wa ligi kurejelewa Juni 8 na kukamilishwa Julai ili kuambatana na ratiba ya UEFA. Hata hivyo, kuna habari njema nchini Uhispania baada ya wadau wa michezo kuruhusiwa kurejea mazoezi kuanzia Mei 4 kama hatua ya mojawapo ya taifa hilo kumaliza masharti ya kutokuwa nje usiku na mchana. Kuruhusu watu binafsi kufanya mazoezi ni sehemu ya awamu ya kwanza ya hatua zilizotangazwa Jumanne na Rais Pedro Sanchez kuandaa watu kwa ajili ya kumaliza masharti ya sasa. Wakuu wa ligi tayari wametuma mwongozo kwa klabu zote kuruhusu njia zitakazozingatiwa kuzuia maambukizi zaidi ya Covid-19. Uhispania ni mojawapo mataifa yaliyoathirika zaidi na janga la corona, hususan idadi ya vifo vya kinaya. Ni kwamba tangazo hilo limetolewa siku moja tu baada ya majirani zao Ufaransa kukata kauli kwamba ligi zote hazitarejelewa kamwe hadi mwezi Septemba. Mtazamaji, shukran za dhati kwa wale wote wamefanikisha taarifa za NTV alasiri. Mimi ni Kaltun Njama. Mengi zaidi katika taarifa zetu za NTV jioni, naye mwenzangu Salim Saleh.
Allahu Akbar, Allahu Akbar.
During this period and always, bank different by avoiding interest in all your transactions. If not now, when? Ensure that all your transactions are free from elements of uncertainty and gambling by only investing your money differently. Bank on strong partnerships where generated profits and risks are shared by both parties. Bank different with Gulf African Bank. Call us on 0711 075 000 or SMS join to 21981. May God protect us. Ramadan Mubarak.
This is NTV.
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain. If symptoms persist, seek medical advice.
Basic protective measures as guided by the World Health Organization. Clean hands frequently with soap and clean water. Cover nose and mouth when coughing and sneezing with a tissue or flexed elbow. Avoid close contact 1 meter or 3 feet with anyone with cold or flu-like symptoms. If you have fever, cough and difficulty breathing, seek medical care early. Avoid raw or uncooked animal products. Help the world put an end to the spread of respiratory diseases by sharing this message with a friend. Message brought to you by Sour Herbal Family Bath Soap.
Breastfeeding ruins the shape of your breasts. This myth is false. Feeding your baby at night makes breastfeeding easier. Yes, this is true. Small breasts can't produce enough milk. This myth is false.
Kiss Kids diapers. Kiss Kids, no rashes. Kiss Kids, no rashes. Bye-bye rashes. Buy diapers. Choose Kiss Kids. Birthday party. Birthday party.
Birthday party.
Birthday party.
Are we not invited? We have gifts. Malaria.
Mommy, best.
Run.
Oh, die.
Party.
Compared to an ordinary spray, Mortein Doom Power Guard kills disease-causing pests instantly. Mortein Doom Power Guard.
Nyaje wa Kenya. Hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water. Apply a small amount of soap. Rub palms together. Rub fingers and thumbs and the beads in between. Rub nails on palms. Rub the back of each hand. Rinse with clean running water and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
I tried to, do the gymnastics I was used to as a photographer. I want to climb up somewhere. But when I did that, I came down with part of that wall.
The prevalence of obesity amongst adults is at an all-time high, especially in women.
Whenever you're taking rice, you're taking almost an equivalent of the same teaspoons of sugar.
We try to understand why and how this can be managed.
Big fat farewell. Kwa heri mafuta. Mafuta tuachie gari.
What are your plans now? Erica's been reunited with her son.
Honestly, Agatha, I really don't know if I should praise or hate your sister.
You should hate her.
That mother and son might report us to the authorities. Now we've got a new problem. We have to get rid of Jolo and Erica as soon as possible.
If that doesn't happen, you and I will take him down ourselves.
What happened to our men?
Unfortunately, they were killed by the cops.
I'm sure they'll do everything to silence my son. And until those kidnappers are caught, none of us are safe here.
Heaviness and a burning inside, it could be heartburn.
Indigestion and heartburn? Eno gets to work in 6 seconds and works on the 6 symptoms of heartburn so you can keep living life non-stop. Eno, fight heartburn and indigestion fast.
East Africa is transforming. And so are we. We're now more diverse, more visual, more engaging. Grab a copy of the new East African. To subscribe, email subscription at